This time of year, there's nothing better than sitting outside in the patio with a cold drink in your hand, especially at Long Necks. Each of the three Long Necks locations has an outdoor patio perfect for the summertime. The beer selection is terrific, and if you haven't tried Long Necks wings, what are you waiting for? And yes, there are TVs outdoors, so you're not going to miss any of the action. Long Necks has locations in Wilder, Hebron, and Richwood, each one of them very easy to get to. Long Neck Sports Grill, this summer, stay late. Come often. We do this every Wednesday. We chat with one of the experts from OrthoCincy, orthopedics and sports medicine. These guys are terrific. Great thing about OrthoCincy is they have specialists and locations across the tri-state, and they also offer walk-in orthopedic urgent care weekdays from 9 a.m. to 9 p.m. and on Saturdays from 9 a.m. to 1 p.m. in Edgewood and Eastgate. Learn more at orthocincy.com. That's orthocincy.com. We talk injuries. Dr. Angel Velazquez is with us, as he is often. Let me start with Graham Ashcraft. So his last start against St. Louis, he took a comebacker off his calf. He limped around. They examined him. He stayed in the game for a few hitters. They ultimately took him out of the game, and he has since been put on the injured list with what they are calling is a calf bruise. Now, a lot of people are going to see bruise and think, okay, that's no big deal. Why would something like this be bad enough for him to be placed on the IL?
Well, thank you for having me again, Mo. I'm always happy to be here. First, it's depending where the injury happened and where the hit or the ball hit him. If you are hitting on the inside of your leg, there's your calf muscle, right? So you get a contusion, you get a bruise, that ball's coming quick. So you're going to have a hematoma, and your muscle can be sore. You can have a little bit of blood irritating the muscle. You may need a little bit of time. So you wait a couple of days, see what happened, and then if it's not recovering quick, you definitely, use those 2 weeks or whatever time it is. If the hit or the contusion is on the outside of the leg or the lateral aspect, there's a little small bone there that is called the fibular bone. And the fibula is really close to the skin. And when you get hit there, man, you feel it. And you definitely going to have bone bruise. And that bone bruise can be lingering and can take a little bit longer time. So, the first thing that you do is you give a couple of days to see if he can recover. And if he's unable to push off the man or having a lot of pain while landing and he cannot be efficient and he's changing his arm slot and his mechanic, then obviously you need to take some time off. So definitely the area where he get hit, change the approach or how long it's going to take him.
I'm always fascinated when you see something like what we saw with Graham, where he suffers an injury that ultimately puts him on the injured list, but in the short term, he's still out there. He was still trying to gut through and get hitters out. I watched a pitcher once, and for the life of me, I cannot remember who this is, but he once was trying to field a bunt. He broke his thumb. He was done for the rest of the year, but he actually pitched 2 more innings after he broke his thumb. So sometimes you'll see an athlete that just pushes through, and then you find out actually the injury was pretty severe. Does this just happen because of adrenaline?
Absolutely. You're a professional athlete. Those guys, it's been like a marathon runner. You go through pain. To be able to go there, you learn how to tolerate pain. You learn how to, go through it. And definitely, when they got hit, they say, you know what, there's difference between being injured and being hurt, right? So the moment he felt, okay, I feel hurt, but the question is, I'm injured. Well, my mind tells me I'm not, and I'm just starting this game. I'm going to finish. So then you go there, you start throwing, and then suddenly, that start locking on you. You start having some cramping on it. Then, you start feeling more pain, and you're like, okay, I need to be a little bit more smart in this. And, that's probably the reason why he was able to pitch those 4 batters, and then he say, I need to call it.
Let me ask you about Jake Fraley. So last week in the comeback win over the Dodgers, the first comeback win over the Dodgers, he was hit by a pitch in his wrist. The next day he was scratched from the lineup. He has been sidelined with what they're calling a wrist contusion. I guess it's kind of the same question as before. Besides limiting the use, what are the treatment recommendations when you've got somebody dealing with a wrist contusion?
Obviously you get a hit by pitch. The ball's coming quick. It's coming hard at you. You gotta, there's some areas in the bone that you don't have any protection, right? And the question is, what exactly happened? Do you have a bone bruise? Do you have a fracture from a dent from getting hit? Do you have a more significant fracture? I remember a couple of years ago, Suarez got a thumb fracture, and he was able to come back. I remember, I think it was like 10 days later. So, even with a fracture, depending what it is, you're able to come back. But, this type of contusion, this type of pain, is depending. Can he grip that bat and he can swing efficiently, to be able to produce at that level? If the answer is he can't, well, that's when you go on the, injury list, and then you give it a little bit more time. So the first thing is how he feels the day after, couple day after, getting some treatment, icing, compression, all the things that they have to do to get the inflammation down. And then after that, you evaluate, can he grip that bat, can he swing, can he throw the ball, and then make those decisions.
Yeah, I mean, it's really a range of motion thing, right? Because you think of it helps when the wrist isn't sore, but can he snap the wrist throwing? Can he snap the wrist batting? I mean, you think of all the, I don't know, sort of stress that you put on that one particular part of your body. I'm curious as to whether or not a professional athlete can get full range of motion after 10 days.
Well, that's where the texting is going to be important. You're talking about an MRI that you look for bone bruises. MRIs sometimes can miss a little fracture, so you can do a CT scan too. And if you don't have a lot of bone bruise and it's more soft tissue, means surrounding the skin, surrounding the muscle, you can regain that range of motion pretty quick. But if it's in the bone and that bone hurt, every time you move your wrist, there's ligament attaching to those carpal bones in the wrist, then it's going to be harder for you to get that motion. And then it's going to take you probably a little bit more time. But obviously, you use the minimum that you can do, because you can put it on longer, injury list time. So you're trying to use the minimum, so you don't put on a long term. For example, you don't put on a 60-day and then you need 3 weeks and then you're done. You know what I mean? You put on a lower one and then you can take a little bit longer time, but not up to 60.
Dr. Angel Velazquez with OrthoCincy is with us. Joey Votto is inching closer to a return. He is in the middle of the second rehab stint he has gone through this year, obviously trying to come back from rotator cuff and bicep surgery. I want to talk about older athletes. Joey is going to be 40 years old in September, and we hear this all the time. Well, athletes get older, they're either more injury prone or they have a more difficult time coming back from injury. Talk about this from a clinical perspective. Can you take a deeper dive into this and tell us why this is?
Well, it is simple. It's about the mesenchymal stem cells production, number one. When you are born, you're a newborn, you have, you have these stem cells in your body that is 1 on every 10,000 cells, right? When you go into your teenagers, you have 1 in 100,000. When you go on your 30s, you are 1 in 250,000. And then when you keep going to 50, 1 in 400,000. And when you're 80, 1 in 2 million. So what it's telling me, the concentration of those stem cells goes down significantly, right after you were a newborn, and it keeps going down the older that you get. So those stem cells are the cells that repair your body, and those are the cells that help you with injury. That's one of the main reasons. The other thing is muscle, tendons, they get stiffer. They're harder for them to regain that range of motion, and it's harder for them to come back and get stronger and get more flexible again. So there's multiple things what can be happening that is, not allowing, an athlete, I'm not going to say directly Joy, but an athlete to come back after an injury or after a surgery. So, there's multiple reasons why. And, you guys know by history, looking at how Joy is being, he want to be able to compete. The type of player that he is, he want to be sure he's right to be there and compete. So if he doesn't feel right, he will take the time for sure. But definitely that's the reason. One of the reasons is the cells of your body that help you to heal just take a longer. You have less of them, so take you longer to heal completely.
Awesome insight as always. We'll do it again soon. I appreciate you interrupting your meal to chat with me. Always good to have you. Thanks so much.
Well, I have a question for you.
Yeah.
You remember which pitcher in 1919 got struck by a lightning, and after being revived, he was able to finish the game?
He was struck by lightning.
Yes.
It was Ray Caldwell.
Yes.
Ray Caldwell.
Yes.
Chicago White Sox or Cleveland Indians. It wouldn't have been the White Sox because 1919, that team's pretty famous. That had to be Cleveland.
Cleveland Indians. He got thrown by lightning in the ninth inning. He was able to finish the game. And the more important thing after that, not the more important, but after that, he pitched a no-hitter against New York 17 days later.
I don't think I knew that. I think when he got struck by lightning, it was in the ninth inning, so he had pitched almost the entire game and he finished it up. I did not know he threw a no-hitter in his next start. Well, pretty good.
Yeah, 17 days later. I don't know. Maybe he started 2 days later. Remember they used to pitch every other day, I guess.
Wow.
Time has changed from there.
No question about that. All right, good stuff. I like it. Now, when you join me, you got to give me a nugget like that. You can test my knowledge of useless information.
Well, I'll tell you something. I just get that idea when I was actually eating my sandwich. I don't wanna say from where because I don't wanna give any free advertising to people.
My man.
Take care, man.
All right, I'll see you. Thank you. All right, there you go. Dr. Angel Velazquez from OrthoCincy. Go to OrthoCincy.com. Say this all the time. Great thing about the people at OrthoCincy is they've got specialists and locations across the tri-state, which includes walk-in orthopedic urgent care during the week from 9 a.m. to 9 p.m. and on Saturdays from 9 a.m. to 1 p.m. in both Edgewood and Eastgate. Goes without saying it's easier and cheaper than going to an ER when you have an urgent orthopedic injury. And by the way, you never need an appointment. Go to OrthoCincy.com. That's OrthoCincy.com. There is nothing better than a summer night on the outdoor patio at Long Neck Sports Grill. Each Long Neck's location has an outdoor patio. There are 4K TVs, so you won't miss a second of any game you want to see. And the beer selection is top-notch. Nothing's better than a cold beer on a warm summer night outdoors. And by the way, if you haven't had the wings at Long Neck's, you're missing out. Get to Long Neck's, Wilder, Hebron, and Richwood, and enjoy the outdoor patio this summer. Long Neck Sports Grill. Stay late. Come often.